I will pass it over to you.
Well, thank you, Emily. And I'd like to also welcome everybody tonight and thank you for sharing part of your evening with us. We're very excited about tonight's program with Dr. Andrew Lewandowski, who's going to talk to us about engaging with patients regarding climate, health, education. And I've always thought this is a great opportunity for healthcare workers to really utilize our so-called trusted messenger status to teach patients and also try to influence the climate debate. So I'm very excited about tonight's presentation. But before we get started, I just wanted to give a quick 2-minute update on what's happening at New Hampshire Healthcare Workers for Climate Action. Whenever we get a chance to talk to a group, I think it's important for you to hear what we're doing. And we have 5 working groups, as I'm sure most people know. And I'll just run through those quickly. The Communications Education Working Group also includes the Speakers Bureau, and we've given over 60 community talks about climate and health, actually gotten in front of 800 New Hampshire citizens. We speak to service clubs, faith groups, students, and climate groups, and are always looking for new venues. So if anybody in the audience tonight can recommend a venue, we'd appreciate that, and you can reach out to Emily to do so. We also have a very active Letters to the Editor group that's written scores of letters and op-eds in the last 6 months, with particular interest leading up to the November election. The Policy and Advocacy group is working with several other New Hampshire climate groups to monitor activity in Concord, and several of our members have given testimony on active bills relating to the climate in Concord. The Children's Health Group has started a new program entitled CHICS, which is a grassroots community integrated program in the Kearsarge and Sunapee area, geared towards protecting the emotional and physical health of children in the face of a warming climate. The Climate Justice Working Group is collaborating with academics at UNH, Plymouth State, and Dartmouth to design health equity and climate justice projects around the state. And finally, the Behavioral Health Working Group is doing a lot geared towards education of caregivers and have written a set of climate and behavioral health guidelines for practitioners. And one of their newest current priorities is nature-connected wellness. So you can see there's lots of activity here, but we are always looking for fresh blood, new ideas. And so if anybody in the audience tonight would like to get more active with the group, please reach out to Emily at our website. So now for the main event. As I said earlier, we're delighted to have Dr. Andrew Lewandowski with us. Andrew is a pediatrician with Group Health Cooperative in Madison, Wisconsin. He focuses on clinical-based counseling about climate change and health, recognizing the importance of equitable climate change mitigation and adaptation solutions on human health. Andrew was also recognized by the Medical Society Consortium on Climate and Health, which is our parent organization, as a champion in 2020 for the work he was doing and continues to do in Madison, advocating for climate justice and climate solutions. Andrew's also written on this topic and is really a national leader in what we now refer to as climate-informed healthcare. So Andrew, you're my hero too, and we're delighted to have you with us this evening. So please go ahead.
Yeah, well, thanks for having me, everybody. I just want to say that what y'all are doing in New Hampshire is really, really awesome. So keep up the good work. It's really cool to see some of your faces today, and it's just awesome because I think a lot of us realize that a lot of this stuff moves forward because of a lot of the work that's done at the state level. It's really pretty cool to be able to be part of this group tonight. But what I will do is I am going to pull up some slides. And so for the first part of the session today, it'll be me talking through some of these slides, talking about approaches. But then I also want to make sure that we all have time tonight to have really an interactive session where I don't care what part of healthcare you work in. I want to make sure that we do some brainstorming about how you can do this. that you can do this in your healthcare setting. So that will be the kind of where we're going towards the end of the visit today. So let me pull up my screen. And all right, so you should hopefully all be able to see that. And this is what we will be talking about tonight. I am a pretty informal presenter. And if you've ever presented using Zoom, you know that you cannot see the chat. So if anyone has questions, please feel free to just unmute yourself and go ahead and ask questions. Alternatively, if someone wants to monitor the chat, that would be great too, if anything seems to come up that's timely pertaining to the slides. And then I will stop sharing the screen when we do that more interactive session at the end here. But this is what we will be talking about. So taking climate into the clinic, so communicating with patients, that is the topic. And I also have an Indigenous land acknowledgement. The land that I'm presenting from tonight was previously occupied by the Kickapoo, Ho-Chunk, Peoria, Sauk, Sioux, and Miamia tribes. And as presented, I'm a pediatrician who this year actually in my clinic, my last patient was at 5 o'clock. And so this is this is me presenting from clinic. And I am also a climate advocate, and I work primarily with Wisconsin health professionals for climate action. But these are the goals for tonight's session. So review the professional recommendations for climate change and health, and we'll see how many of you are surprised and not. The second one is to examine the process and results of one approach to communicating with patients. This will be the approach that I've taken in my clinic. And then, like I mentioned, I want everyone to feel at least a little bit more comfortable about figuring out how to incorporate climate change and health counseling into your healthcare setting. So many of you have learned about climate change and health. And so it's always great to say, well, what are current healthcare recommendations? And if there is a healthcare organization that's important to you, I would encourage you to look things up. There may be a recommendation that you don't know already, or maybe you do, maybe you are aware of it, but I'm not going to go through all of the healthcare recommendations because there's a lot of alphabet soup out there. But the American Public Health Association, they say that we should be planning for climate change, disease prevention, and preparedness. They want to make sure that people know that this isn't just about, a polar bear on a melting iceberg, but that it's affecting humans. And they encourage, us to educate others about the negative impacts of climate change on human health. The American Academy of Pediatrics, in their position statement from 2015, say that we should be educating other healthcare workers, medical students, public, we should be educating about the effects of climate change on child health. They have stated that we should incorporate climate change into the anticipatory guidance framework. So anticipatory guidance is, what we tell people that they should be concerned about for their children, and we should be working climate change into that. That we should reduce our own healthcare footprint, that we should bring disaster readiness into our clinics, that we should advocate for reduction of greenhouse gas emissions, more globally speaking, not necessarily just in healthcare, and that it's an interdisciplinary problem, so it requires interdisciplinary coalitions to address. And then there are 6 additional recommendations in their policy statement that are targeted specifically towards government leaders, policymakers. The American College of Physicians, so now we're doing the opposite, that internal medicine realm that just gives me the creeps about seeing, patients above age 25-ish. But they say largely a lot of the same things. So lifestyle changes at home and work. You got to practice what you preach. Educate the public on health consequences of climate change. Advocate for reduction of greenhouse gases. And I thought that this statement down here was worth the quote, but it says the medical profession, by being an objective and trusted source of information about the effects of climate change and health, must be at the fore of this opportunity to make Earth a sustainable home for future generations. And then, if you aren't aware, the American Medical Association has a journal of ethics, and they have an entire issue that exists just for climate change and health. And this is a snippet from that issue. And it says, the health consequences of climate change are visible, often measurable, pose serious threats everywhere, and offer opportunities to significantly improve health everywhere. Embracing sustainability at the individual or organizational level thus helps to fulfill the professional obligation to protect health. And so when people when people ask me, well, what did you do? Or how do you bring this into your clinic? First and foremost, after going through all that, I want people to know that all I did was follow the recommendations. And so when you think about position statements or policy statements or resolutions or best practices or all of these other words that we tend to throw around in healthcare, this is communicating about climate and health, educating about climate and health, all of that's just following recommendations. And I remember when I was in residency, one of my attendings told me once that, generally you should be looking to adopt recommendations or best practices within 3 years of publication of them. So when the new ear infection guidelines came out in 2016, your goal was to have things adjusted to your practice by 2019. And if you're lagging 3 years behind, that maybe we're kind of like in need of working on that. And so when I first read these recommendations and saw that as a pediatrician, the AAP policy statement, which is from 2015, and it was 2021 or 2020 or 2021, I mean, that's well outside that 3-year mark. And it's like, well, geez, we have to start somewhere. And being a climate change or climate justice advocate, who would be better positioned than the people who are more involved in all of the health ramifications of climate change and health. Now, specifically what I did is I worked it into my social history. I'm not going to read all of this, but this is what my social histories look like. This is a made-up patient, 5-year-old Atarva. And, I ask about what things are like at home, where they live, what their parents do, social agency enrollment, kind of factors at home, and then continued on to the next part. I mean, I usually talk about safety in my social history, in addition to some of these things. And then towards the end, I talk about climate footprint and I address discrimination. I'm going to present some data in the next few slides. And so even though this is what my documentation says, which is climate footprint discussed, for the purpose of the data in the next couple slides, I'll tell you what I would tell people back in 2021 for the purpose of the paper, which is I told families in the last 2 years, the American Academy of Pediatrics and over 100 other health organizations declared climate change a health emergency. Yeah, air pollution alone caused over 64,000 premature deaths in the United States in 2016. And worsening air quality is only 1 out of 9 ways that climate change is harming people, disproportionately harming children. So just like I want your children to eat healthy foods and be in the right car seat for their health and safety, we now know that decreasing our energy use, increasing energy efficiency, and supporting clean energy initiatives are also important for improving our children's health. Do you have any questions about that? And that's effectively what I did. The message that you might have for your own practice could look incredibly different for a variety of factors that we'll get into in a little bit, but it seemed to be a pretty good fit for the practice that I had. And so after speaking with other pediatricians, the AAP has a group of pediatricians who meet pretty regularly. I heard that really it didn't seem like too many other people were doing this. And I was like, okay. And people are like, well, how are people responding? What are things like in clinic? And I was like, well, no one's really walked out of the room. Nothing seems to be awful, but I didn't really have a good answer for that or if it was affecting a change. And so I said, well, I don't know. Is that 45 seconds that I spend talking to my patients worth it? And so I generated a 7-question survey. I administered it to 234 patient families, had 138 responses. So it's a 58.5% response rate, which is excellent in the realm of survey land. And the 5 main things that I wanted to know were, 1, did they learn more about climate change related health harms as a result of the counseling? Were they more likely to save energy as a result of the counseling? Were they more likely to support clean energy initiatives? Did political identity play a role? And then what are the free responses? What are those reactions to counseling? I think anyone who is a clinical practitioner knows that a lot of times you get smiling and nodding. At least here in the Midwest, there's a lot of passive aggressiveness. Maybe out on the East Coast, it's a little different, but people will smile and nod at you all day. And then that patient satisfaction score with the free response, they might rip you a new one in that section. So, I really wanted to give people the chance to tell me what they really thought in an anonymous free response section. And so that's why I incorporated that last component. And so then I worked with Dr. Sheffield, Adut, and Maybach to publish it in the Journal of Climate Change and Health. I cannot speak praises enough for these 3 colleagues. They were wonderful at helping this non-academic research, non-research heavy clinical practitioner to have this come to fruition. And here are really the results. And you can see these ends are fairly low in some cases. And so I will not claim any sort of statistical significance, but it just sort of gives you a flavor of what to expect. So how many people felt like they had a prior understanding that climate change was causing harm to their health? And across the board, all participants, 82%. And then as you might expect, you might see the liberal participants, moderates, conservatives, that the numbers are sort of trending in that direction that you might expect. But frankly speaking, the way that people traditionally talk about conservatives, if I have 57% of conservative patient families saying that they're aware that climate change is causing harm to health, I mean, to me, that's already kind of a pretty big win, for people who tend to be concerned about, for healthcare providers who might be concerned about how conservative typo, but please overlook that. And then learn more about health harms from climate change during the clinic visit, meaning, as a result of that counseling, do you feel like you learned more? And you can see here, again, even though it was 45 seconds, I felt like I wasn't really providing much information. Clearly, it did leave an impact. Now, likelihood of changing energy use behaviors was a Likert score from very unlikely to very likely. This very unlikely or unlikely is definitely important because sometimes you can have sort of an unintended backfire effect from counseling. And you can see here that nobody was really less likely or, unlikely to change energy use behaviors. So this is, weatherizing your home or reducing your energy use as a result of the counseling. And then again, really, really, really positive responses. So 11% total said neither likely nor unlikely, which means 89% are in the likely to very likely category. And again, going down to the conservative participants, 21% said neither likely nor unlikely, which means that 79% were more likely to change energy use behaviors because of the 45-second snippet that I read to you earlier in this presentation. Supporting clean energy initiatives. Again, same kind of data. So support across the board. And then the free response section, there were 96 free responses. If you go to the link, which I saw is actually on your website, on the New Hampshire State Group website, you can actually access all of the free responses if you're curious. But we broke down the free responses into 4 themes. I'm going to go through 2 of the themes today, highlight 2 of the themes. First is counseling effectiveness. So, in the free response section, one person said, we appreciate it. We've made changes since having our first child due to the information provided. Another person said, we didn't previously realize how its importance stacked up against other child-related safety concerns. It's better to understand the gravity. This group, I'm hiding the theme for now, but it says, this person says it was very informative. We already use LED lights in our house. We're getting new windows installed in the next couple of months. We don't drive around very often because I stay at home with my daughter and my husband works 1 mile from our house. We have a smart thermostat so we can save our energy costs that way. Another theme response I'm highlighting is it's good to know, change things in our home to make it healthier for our children. From the responses you're seeing in this section, you wouldn't necessarily realize that these are all conservatives who provided free responses. And so I'm really just trying to dispel that belief that, we should be worried about the political ideology of our patients when we're trying to express our healthcare recommendations. And so in general, my communication approach does include a few principles. And this is really just this is nothing that's new. In fact, it's based on a lot of already existing evidence for behavior change and interviewing and talking with patients. But, at the end of the day, as healthcare professionals, our job is to give recommendations, right? I'm not going to go to anyone's house and force their children to eat 5 servings of fruits and vegetables combined per day. No, instead, my job is to say, hey, these are the recommendations for what we want to do for diet, exercise, screen time, name whatever it is. Someone has an ear infection. This is the antibiotic that I want to use if your child is under 2, and this is why. Here are your side effects. It's really just about providing a recommendation. And so when you approach it from that standpoint that, hey, I'm not here to force you to do anything. I don't want to, kind of leading into point 2, I don't want to butt heads with anybody. I'm just here to say, hey, this is what we know about climate change. We know it's impacting human health, and you give that recommendation, then that's really just you doing your job. And it sort of takes the personal nature of headbutting out of things sometimes. And then I think another thing, so when you first get started with anything, whether it's, giving bad news or concerns about something that can be perceived as politically polarized, I think as providers, we want to make sure that we're up to date on what are the most current facts and statistics. I want all of my information to be absolutely perfect. And I'm not saying that that isn't important. It's absolutely important to know the information you're trying to relay. But if you're talking about behavior change, you don't need to give a 45-minute lecture. And in fact, the data I'm presenting show that 45 seconds was enough to get people to think about this a little bit more and potentially make some changes. And so really, when we're thinking about facts and statistics in the clinical setting, you should be trying to elicit emotional responses. When I said that air pollution alone caused over 64,000 premature deaths in the United States in 2016, I mean, it doesn't really matter if it was 64,000 versus 68,000 versus 62,500. It's really like, holy cow, I didn't realize that air pollution was causing so many issues. I didn't realize climate change was such a problem. So again, choose those facts and statistics that you think are going to resonate with your patients and patient families. And then this is a general principle that we talk about ever since medical school. You want to go from least invasive to most invasive. And so that's why in my social history, talk about who all lives at home and what's it like there before you're talking about politically divisive topics and discrimination, right? You save the drug, sex, and rock and roll towards the end of the visit. You don't start off your visit by saying, so let's talk about climate change and health, because maybe that might not have the intended effect if there is a risk potentially with patient rapport and building rapport with your patients. Now, as far as the people you work with, sometimes we worry about that. And I will say these are some of the reactions that I've gotten from my colleagues. One colleague, and this is probably the majority of what patients say. I am in Madison, which is a pretty liberal area, but that's so great that you talk to climate change with your patients. I'd love to hear more about how you do that. This was actually from an email. This is actually the pediatrician. She's since retired, but this was a pediatrician who used to work in clinic with me. And she would actually heckle me a lot for the work that I was doing. And she would say, I remember when scientists were saying that the Earth was headed for an ice age. And she was referring to, I think, a Reader's Digest that was published in the 1970s. And I remember when they showed pictures of the Indians crying, kind of talking about trying to decrease pollution. So I'm not saying that you're not going to get negative reactions from colleagues or that negative reactions won't occur at all. And instead, I'm just trying to prepare that, hey, again, we have all these professional organizations that are backing up the fact that you would be practicing good medicine if you're incorporating climate change counseling into what you do. And so maybe this is an opportunity to speak to them or show them that policy statement, or, not necessarily take it personally, but just say, hey, I'm just trying to follow the guidelines, just like I know I'm supposed to give that amoxicillin to that kid for that ear infection under 2 years of age. It's their first time. Learners, if you have residents, if you have medical students, they can do this too. I have a resident in my clinic, and when she was first starting out, this is pretty much what I was getting from her. And she was like, wait, what? Not something she learned in medical school, not something that she ever practiced. So, our patient's going to get mad at me. We did spend a little bit of time talking about it. I showed her my approach, told her she can counsel about it in whatever way feels comfortable for her. But obviously there was a general degree of discomfort compared to, hearing about smoking cessation counseling or so many other things that we'll oftentimes get to witness throughout medical school. But yeah, you always start off as a learner, and then you have to start practicing. She would come out of the room and she'd be like, I kind of butchered that environmental talk a bit, but I am getting better. Here's what we talked about, or here was what I was able to say. And then eventually, she was, I would say maybe by the end of that first year, very easily she'd be, I would honestly, even within the course of 6 months, it's a half a clinic day a week. And I would say within the first 6 months, she eventually would say, yeah, I addressed the climate change and health counseling in the last visit. And that was it. And so you all, if you are not currently incorporating climate change into and health into what you do, you're up here, and that's okay. And then eventually we get here. And I have butchered so many talks. We've all had times that we butcher talks in our clinics or in our hospital setting or wherever it is that we practice. And remember that that's okay. We all have to start somewhere. But medicine changes with time, and we have to adopt new guidance topics and talk with patients. And so eventually we'll get to the point where we feel comfortable with what we're doing. And if anything, we'll start to tweak things. The reason I had to look up what I said for the talk is because that was counseling I provided in 2021. And even though that's what I said then, I actually have a different climate and health talk that I'll give to patients now. Based on my ongoing relationship or bringing it up again at my well child checks. So it is a work in progress, and just remember that that's okay. And so some closing thoughts about discussing climate change and health before we talk a little bit more about individual settings. First is that we can be succinct. Climate change and health can be discussed succinctly in the healthcare setting. You don't need a 45-minute lecture to talk about it with patients. Secondly, is that climate change counseling can make a difference. I mean, it seemed to make a difference in the patients that I spoke to. And another thing is that your relationship with your patients, in my opinion, is what makes this work so important. So they care about what you think. And, thinking back through COVID, I had so many patients who, COVID vaccines coming out, and they don't care about what, Dr. Fauci is saying. They don't care about the CDC. They don't care about the WHO. They cared about what I thought. And, realistically, like, oh, that's very nice, but I do not know more about all of the potential ramifications compared to, some of those national leaders, or compared to the analysis that, the CDC or other, major medical organizations are able to provide. Have with your patients that are going to make this relatively safe. It's like, oh yeah, well, I know so-and-so said this, so-and-so said, oh, but my doctor really cares about this. Well, yeah, my doctor talked to me about that. Like, this really matters. And then the last point is we do need leaders on this topic in different healthcare settings in order to help colleagues and learners feel more confident about counseling. Really, until more of us start doing this, it's not going to become commonplace. And all topics have to start somewhere. Once upon a time, doctors never counseled about smoking, right? If anything, there were things being advertised about, doctors supporting this cigarette brand over another cigarette brand. And there had to be a point in time at which that changed over. And we said, yeah, we need all doctors to be on the same page. Smoking is bad for your health. There is no type of smoking that is good. Secondhand smoke is bad. Thirdhand smoke is bad. Nicotine is bad for these different reasons. And the climate change has to start somewhere too, when it comes to counseling. And so the more that we can get every healthcare provider in this country to say, oh yeah, there's absolutely no debate at all that climate change is here, it's human caused, and it worsens human health. That's, ideally where I would love to see our national and arguably international healthcare systems at. So those are the primary thoughts that I have. I have some references here, and then this is mostly what I want to do today. So I'll start off with a Q&A. If people have general questions, if we don't have too many questions, that's fine too. Doesn't bother me one way or the other. I would love to talk more about what you all do and hear more about what you guys do and how you can work it into your own clinic or hospital or healthcare workflows.
Well, thank you, Andrew. That was a terrific talk, and you've given us a lot to think about. It's really inspirational what you've done. And, that one slide that talked about knowing all the facts, I think that's difficult for healthcare workers, I think, in part, because we all are taught before we talk about anything, we need to know all the facts. And Catherine Hayhoe, who's written Saving Us, talks about the fact that people don't talk enough about climate because they're intimidated by not knowing all the facts. And I think by giving that, giving a 45-second talk, you sort of relieve healthcare workers from that burden of the facts. And I really do think that plays a role in people's reluctance somewhat to kind of open that box. What do you think about that?
Yeah, I think that's great. I actually tend to compare, communicating about climate change and health in the clinical setting to speaking a foreign language. I feel like there are so many Americans who feel like they need to be fluent before they can try and use that foreign language in a different setting.
Right. That's it.
But at the same time, if you never practice and make mistakes, then you don't become fluent. And so it's this self-fulfilling prophecy where until you do it, you can't get better. And, I think what I hope takes the angst out of this for healthcare professionals is that you have institutional support. You're not some like fringe tree hugging, dirt worshiping provider who's like, yeah, guys, climate change and health is bad. Like, no, I mean, you have all of these big name organizations, over 150 organizations around the country saying climate change is a human health emergency since 2019. You have these position statements going back as late as 2008. This is not new. You are supported by your healthcare organization. And just like any other healthcare recommendation, you don't have to know all of the information, and you don't have to know everything about any particular health topic. And so if a patient has a question, you can say, hey, you know what? I don't know the answer to that. That's a great question. Is it okay if I look that up and then get back to you? Or, you know what? I don't know all these details. I do know that it's important. And this is the institutional support around the question that patient had. So remember, you don't have to be an expert on climate change. It's multidisciplinary, and it's multidisciplinary for a reason, for sure. And then just one other thing is that the way that I counsel is because of the healthcare setting that I'm in. And so I would not expect that the way that I counsel would be the way that you all will counsel. We have different specialties in which we practice. You have different patient populations. I focus a lot, I tend to focus a lot more on things like climate mitigation, reducing energy use, or supporting clean energy initiatives in my talk, because I have a lot of affluent patients. I have a lot of privately insured people. But you know what? If I was more in like a safety net healthcare setting, or if I was in a different situation, perhaps I would be spending a lot more time trying to stratify climate change risk and talking about adaptation. I mean, generally speaking, the people who are vulnerable populations based on a variety of societal contexts, not necessarily the biological components of, being elderly or being a child, but, being part of a BIPOC community, or if you are economically disadvantaged or things like that, where you have societal influences that put you at greater risk, then maybe what you're doing instead is talking more about adaptation, because those people already tend to have some of the lowest carbon footprints that exist. And so telling them that you should reuse your water bottle when they already reuse that because they don't want to spend money to get another one, I mean, that's not where that is. Instead, you should be talking to them about making sure that they have a way to access a safe place when it comes to heat indices when they're above 90 degrees, or making sure that their asthma is well controlled and they have an understanding about air quality index, or any number of factors that might affect your patient specifically. So please, this is all about adapting things to your setting. And then the more providers who we have who feel more comfortable with this, those are just more experiences in which you can share with other providers and say, hey, well, here are my experiences with my patients based on what I've been doing. And this is what my patient population looks like. This is the specialty in which I work. And then eventually, hopefully, that's how things become more validated and best practices can evolve.
Thank you. Paul, you have a question?
I do. There are a couple of questions in the chat that we should get to as well, but I'd happy to jump in first. You live and work in Madison, Wisconsin, which is a pretty liberal place. Do you think that 14% of people who returned your survey who identified as conservative, do you think that represents the rate in your community as a whole and the rate in your practice as a whole, or were the respondents somehow self-selected to make that number lower or higher than in your practice and in your community?
That's a really great question that I don't have the answer to. I can tell you that while Madison is associated as a liberal town, there are plenty of conservatives. I would just tend to call them more like closet conservatives, where they don't want to say they're conservative because they know they live in a liberal community. And so part of me wonder, and the other thing is we have to contextualize this as being a survey that was done in 2021, which is like very, very, very much like post-Trump. And so what do you call conservatism in the age of Donald Trump compared to conservatism in the age of Ronald Reagan? And so, someone who might self-identify as a moderate, well, are you a moderate? Are you a moderate conservative? Would you say that you're a conservative? I tend to look more at the moderate responses when I was trying to get a sense for where people are. I can tell you, when you go through all those free responses, 96 free responses is pretty decent. And I do have it broken down by self-identified political ideology. So if you want to take a peek, go ahead. But I would say the worst response that I saw was fine, but not necessary.
And did you have, quick follow-up, did you have anybody butt heads with you and tell you to shove it, or, that you were misinformed?
No. And I'll be honest, like those first few times you started doing it, you're like, oh my gosh, like you're just waiting, and you're like reading the room, you're trying to look at their faces. Like, it's okay to be nervous about this because you care about what your patients think and how they're going to respond to you. And you worry like, oh my gosh, if they think I'm off the wall about this, are they going to stop caring about this? Are they going to switch to another provider?
That's how we feel in New Hampshire when we have to bring up guns and gun safety. It's like,
right?
Are they gonna yell at me for bringing up gun safety?
Right. And so, but at the end of the day, I think that, and you know what, there isn't anything that says, that's the nice thing, at least for me, about primary care, is I can build rapport over time. And so when I have a patient who's there for like the 3-day newborn check in my office, and I have a mom who's like really worried because her milk isn't in and their baby's dropping weight, and we're concerned about bilirubin, I'm not talking about climate change at that visit, even though it's a well child check. Just like if there are other things that we need to address at a visit, sometimes it's just not the right setting to talk about that. Or maybe for you, it might not be the right setting to talk about something that may be emotionally exhausting for a patient about guns. But there are also pretty clear recommendations about gun safety or other safety. And in Wisconsin, I will tell you that Thanksgiving is the second holiday, that deer hunting season is hands down the first holiday for many Wisconsinites here. And so when I ask about guns in my clinic, like if they have guns at home, when I get that like look that maybe you've received in your clinic, I say, hey, it doesn't bother me one bit at all if you all have firearms in your home. We have to make sure that they're stored safely because I care about your children being safe at home. And then we talk about storage systems or ways that we can maybe adapt to that. It's really funny sometimes, and you'll have mom and dad here. And like most recently, I had a mom and a dad here, and the mom was like, no. And the dad was like, yeah, we have guns in the home, but they're stored safely. But the mom just wanted to say no because she knew they were stored safely. And so she didn't want to get into it. And so we already do that. We talk to patients about things that are weird. How many times do we have patients demanding and getting upset with us that we need to give them antibiotics for this cold that we know is just a cold? But we don't say, okay, yeah, sure, we're going to give you the antibiotics because I'm worried about how this is going to go. You say, hey, I can understand that you're upset. You feel really crummy right now, blah, 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 blah. You validate those feelings and emotions. And then you move on and say, and my job is to provide the best medical recommendation that I can for you. And from what I can see, antibiotics are not going to help you with your illness right now. And it doesn't mean you can't feel crummy, but I wouldn't even know what antibiotic to prescribe for you since I don't even have a disease to target, right? Likewise, climate change. Hey, I can understand, you can say like, it feels to me like you're really upset about this topic. I'm sorry if it's made you really frustrated or if, whatever it is that is being expressed in a negative capacity from that patient. And then you say, and at the same time, just like you, my job is to do the best that I can to care about your child. And the best available medical evidence that I have shows that climate change is hurting people and it disproportionately hurts children. And for that reason, I just want to make sure that I'm presenting you with the best possible evidence so that your child can have a safe and healthy life as much as we can. And if you bring it back to the patient, if you bring it back to being I am here to provide medical care for you as best I can. And I care about you and not I care about climate change and health and make it all about this political stuff. That's like why healthcare is so great. You get rid of all the noise. It's all about you. I care about you. I care about your family. I care about your community. I care about your children. I care about that. That's where this message can be so powerful.
Great, thank you. Bob McClellan, you have a question?
Yeah, thank you for that wonderful talk and your demeanor. I can tell you're a great doctor.
Thanks.
So I'm interested in the extent to which you've been able to change practice within your clinic. I don't know what your clinic setting is, but at least several of us on this call are interested in changing at the practice level, not just at the individual physician level. And so if you could speak a little bit to your efforts, if any, or in success in changing practice at the practice level, at the clinical level. And, there's a lot of, you hear a lot of barriers that come up immediately. It doesn't matter whether it's climate change or something else. Any change in clinician behavior is challenging. We know that. So just talk to us a little bit about barriers that maybe you're put up and your success and efforts at the clinic level.
Sure. That is a wonderful question. And especially depending on the setting in which you practice. I know, especially if you tend to, be part of maybe a larger HMO or an academic setting, in those situations, it can feel especially daunting. A lot of times as providers, maybe we feel like, oh, well, in order to provide counseling as a nurse or as a doctor or as a mid-level provider or, any other kind of provider who can dispense medical advice, that I need to get, have a sanction from my parent or employer organization that this is something I can talk about. And I will say that I did not do that. When I saw that the professional recommendation supported me, then to me, that's just practicing good medicine. You don't wait for your healthcare company to say, oh yeah, you can use the best guidelines for smoking cessation, or you can use the best guidelines for managing chronic kidney disease. You just do them. And so I would kind of focus on that in the same way. Now, as far as creating systemic change, that's going to be different. And that's going to be based on the setting in which you work. I will say I work for a relatively small nonprofit HMO. It's just mostly services like a handful of counties in and around Madison. And we have things called primary care conferences where all of the primary care providers get together for a talk once a month. And I presented at a couple of those talks, kind of showing them my approach. And that's how I've had providers who've been able to reach out to me and say, oh, well, how do you do this? Or what do you do? I don't have any data or follow-up from that. So is anyone else at Group Health Cooperative, where I work, counseling about climate change and health? I don't know. The cynical part of me, and maybe not cynical, the realistic part of me probably is saying no. I'd be surprised if they were. But I think that I'm probably if anyone's going to start counseling about climate and health, it's probably going to be people like me and the people on this Zoom, right? I mean, it's not going to be the person who's not involved in climate and health. But hopefully as it becomes more commonplace and part of what we do, then, I think healthcare providers, we tend to be somewhat competitive in ways. And the last thing anybody wants to feel is to be behind on best practices. And so the more commonplace we make climate change counseling standard, then the more everyone else is going to be like, oh, geez, I really got to sit down and do this. I have to figure out how I'm going to work this into mine. It'd be great if the, NCQA or the HCAHPS ratings or any of these healthcare rating systems, which unfortunately are currently tied to Medicare, Medicaid standards or CMS standards, like it'd be really great if CMS could do more so it could funnel down to that, because then all that HMOs would be like, oh yeah, we're meeting that. We can have a 5-star healthcare system. But I think that approach, I've tried going that approach and it did not work very well. It's just barrier after barrier, layers of bureaucracy, and everyone passing the buck. So I found that not to be very fruitful. But if anyone can do that, please do it.
Carl, you have a question?
Yeah, I have sort of envisioning, thank you for the talk, by the way. This is I think important to a lot of us here in New Hampshire, and finding ways we're in fact interested in mechanisms for more systemic change within health systems or clinics, and recognize some of the issues that you just raised, I think. But I'm thinking more individually about some of your work with patients, and imagining adolescent patients in your office, where you're speaking directly to them and not to their parents, what that discussion looks like, and to what degree do you do anything that would resemble screening for anxiety about and worry about climate change in those older pediatric patients?
Absolutely. So I bring up climate change in health, and I bring up discrimination before I excuse parents or other siblings from the room to do the one-on-one sessions with my patients. And when I'm doing the one-on-one sessions, or one-on-one with chaperone, depending on what the patient feels comfortable and what the situation dictates, I will talk about mental health first, followed by alcohol and other drugs of abuse, followed by sexual activity. And that's typically my workflow, just to kind of set that up. And so I would say that there are a handful of times that I've ended up talking about things like eco-anxiety. I do not have to talk about solastalgia. I'm pretty fortunate that the Madison area is relatively well placed, that very few people are displaced from their homes as a result of things like we don't get hurricanes here. We have flooding, but very few people are physically displaced from their homes for long periods of time. And so I would say that most of the time I'm talking with patients about their mental health concerns. It's more related to just worrying about the future related to climate change and health. But I do think that they feel more comfortable talking about that in that one-on-one session after we've already discussed it in that social history setting. So I think that has been a little bit helpful. And really, when it comes to eco-anxiety, again, I just try to normalize climate change and health as much as I would about anything else. And so if you had anxiety about germs, there's an approach you would take to that. If you have generalized anxiety, there's an approach that you take to that. And when climate and health is wrapped into that, I have no reason to suspect that taking care of that child's eco-anxiety would be substantially different than addressing the very real feelings that they have, and making sure that we can provide them with, real information so that they can assess their own risk if that's part of that degree of anxiety. And then especially for teenagers, when it's something that's important to them, they do want to fix things. And so letting them know that there are so many things that they can do that are already in line with goals that I have for their health, like, if you're not on screens 8 hours a day, you are reducing your energy use. When you eat more fruits and vegetables instead of just eating protein and carbs and junk, you are decreasing your carbon footprint. There are so many ways that the existing healthcare goals that we have for our patients, especially those adolescents, factors into what we're already saying. And so that's a good way to tie that in, instead of making it feel like they need to carry a banner to their state capitol, or lead a climate strike, where they walk out of school, or it doesn't have to be that dramatic. It could be as simple as reducing screen use, which then helps their mental health in many ways, depending on what they're doing.
Thank you. Seddon, I see you have a question. You want to unmute yourself and ask it?
It looks like you're muted, Seddon.
You're muted, Seddon.
Sorry, I unvideoed myself, but not unmuted. Thank you very much. I really like that you're able to demonstrate that patients are receptive and that they intend to make changes based on your very short intervention. I'm wondering if you've developed any tools or information sheets or other tools to provide patients to guide them in reducing their energy utilization.
Yeah, so I was looking for kind of globally or nationally something that I could just hand to patients and say, oh, you wanted to know what are ways that you can reduce your carbon footprint? Here's what you can do. The World Health Organization does have a sheet like that, but what I will say that is probably more impactful after kind of looking through things enough is actually if you can compile a list of your local resources, that is so much better. So for example, Wisconsin has a program called Focus on Energy that's funded through the utility rates and the ratepayers. And, you know, a lot of people are aware or have things in similar states where, you know, there's a certain amount of money that you can have reimbursed for different things that modifications that you make to your home or things that you do. Community resources about disaster preparedness, those are going to be very local. I wouldn't look for anything nationally, but I would say that it's going to be very specific to the practice that you have. So while I do have some resources, I don't know that they would be applicable for what you all are doing. I do know that Dr. Shalini Shah, she is doing a preventive medicine fellowship with Harvard right now. If she hasn't already published them, she has these really awesome, I guess they're slides that show correlation between climate change and health, and they're very nice, and I'll see if I can find them if they are published yet, but I've seen kind of the pre-published version that she was trying to kind of shore up, and they looked really, really great. And so I think that some of that stuff is coming down the pipe. I know that Becca Phillips-Bourne, who presented to y'all not too long ago, and Shalini, and there's another pediatrician, Karina Maher, out of California. We have put together a module that is hopefully soon to be approved by the American Board of Pediatrics as a quality improvement project.
Right.
Where you can log in and then do a QI project where you get maintenance of certification credit by bringing climate change counseling into your clinic. And so hopefully things like this are starting to ramp up. But to answer your question most specifically, I would say it would be great for a group like yours to say, hey, what do we have in the area? And then share that with each other.
Yeah.
And then you can bring that in your practice.
Great. Thank you so much for that. We do have a group who is working to develop a toolkit to support climate-informed pediatric care.
Awesome.
So Carl and Bob are both involved in that, I think.
Awesome. And remember, it's not just mitigation, but it's adaptation too. It's going to be dependent on your patient population as to maybe what messages you're going to be hitting.
Great. Thank you so much.
Thank you. Gredia, do you have a question?
Hi. Thank you for the talk. It was very good. Yeah, mitigation, adaptation, and preparedness. Actually, in Puerto Rico, you know, we had almost 4,000 people dying in the 2017 hurricane, and tens of thousands of Puerto Ricans left the island. So we had a lot of climate migrants moving mainly to the States, and then the states that received this sudden influx of Americans coming from Puerto Rico had no resources to, you know, so it's not only from where the migrants are coming, but from, you know, the people that receives them. I helped Shalini translate this into Spanish. When she had the prescription for climate, I asked her immediately if she had this available in Spanish, because, you know, there are many Latino kids in the United States, and so she being in Massachusetts, there are tons of us there. So I translated those for them, and so I made it a collaboration with the Puerto Rico chapter of the AAP and the PSU region too that I belong to. So yes, those are coming out in English and Spanish. I made sure that resources that you could access to them when you click the links were resources for Spanish-speaking people also. But I wanted to ask you, and also toolkits, they have to be regionalized, obviously, in Puerto Rico. What we see with the increased, consistent increase of extremely hot nights and what that implies for, you know, sleep quality and quantity and mental health. And then also with the hurricanes, is a different story, maybe from California with the wildfires. But have you ever thought about, you know, I'm thinking about how long it takes you. You mentioned 45 seconds, but if the patient comes up with, you know, issues of possibly anxiety or, anything in particular that they really want to discuss, and it takes you time, from your, to see your other patients, how about billing these services? In Puerto Rico, our pediatricians are the ones that, from all the nation, our salaries are the lowest. So pediatricians here are in crisis in terms of, they're basically working in kind and just to, enough just to have an office open and bring food to the table. So it's something that I would, I'm trying to promote people talking about climate and health in the offices, but the preventive services are bundled. If you do one thing or you do 100, you're going to earn the same thing, and it's basically around $35 to $40 the most for a well child care visit in Puerto Rico. So, and we're talking about board certified pediatricians. So, saying, I recommend you to do to talk about climate change and health. What do you think, is this ever going to happen? Being able to bill for these services, and how do you do it?
Yeah, so I think that going back to the word succinct that I used, again, it's not about the facts and statistics. If you have relayed at the end of your visit that your doctor knows that climate change and health are connected, and that you care about adapting to and mitigating climate change because of the health impacts, then that's the win. That, to me, first and foremost, that's the goal. Now, then going into the situation where maybe you have a patient who has atopic diseases, or they have a fluid balance sensitive disease, or they have a respiratory condition, or maybe they have a social situation, or like an environment, your environmental history shows that they struggle from, mold due to frequent flooding, or things like that. Then what you do and what you carve out is going to be based on what's at hand. To my knowledge, there is no ICD-10 code that you can bill a carve out for specifically for climate and health counseling. I have asked lots of different people if they know of any, and
No,
like coding
there's
specialists. And to my knowledge, to date, there still is no climate counseling ICD-10 code similar to what you might do for smoking cessation as a carve out. It would be really great if there was.
Yeah,
but
do you think that there should be one?
I think it'd be great. Absolutely. Why
Mhm.
not? I mean, it's according to the Lancet, the greatest global health threat of the 21st century, greatest global health opportunity, depending on which part of the paper you read. And so it absolutely should be. But again, those ICD-10 codes and other things are going to come from national standards, much like the rating systems oftentimes come from national standards. And so that has to be done. My understanding of the situation, it has to be done at more the federal level. And so, we do what we can, but if I'm talking about eco-anxiety, if that's a big component of a child's anxiety or an adolescent's anxiety, I'm not billing it under eco-anxiety, I'm billing it under anxiety.
Yeah,
That's frustrating then for the epidemiologists who are trying to assess impact.
exactly.
Or, you have the number of kids who have respiratory conditions and they live in the Western United States where, half their state's on fire. Fires, and so I do, and there are hopefully, I know that there are things in the works on the informatics side. There are informatics specialists who are looking at trying to say, well, how can we group ICD-10 codes that currently exist, where if I want to know about respiratory impacts that could potentially be related to climate change, that I can sort of group these ICD-10 codes. I know that there are informatics specialists who are working on that. What is his name? There's a doctor, is it Chetan Subaru? He's somewhere on the New England coast. He's working on stuff like that, but I know that there are people who are working on that. So hopefully that will be a different answer in 5 to 10 years.
Thank
But
you.
we all wish we had that answer yesterday.
Yes.
Well, it's 7 o'clock and we'd like to be prompt in our presentations. And so I think we'll stop there. Andrew, I can't thank you enough for joining us tonight. This has been a terrific evening. I can see, you can tell by the questions, it just didn't stop. And you've given us a tremendous amount of food for thought as we try to approach this. And thank you so much for giving us your time. It's been a terrific evening.
Thank you. Well, it was great to be here, and you are welcome to share my email with anybody. Maybe I'll drop it in the chat really quick as well. But if you guys want to talk about what you are doing personally or as an organization, you want to touch base, please feel free to reach out. Happy to help.
Thank you very much. It's been terrific.
Take
Good night,
care.
everybody.
Thank you so much. Have a great night.
Thank you.